Good evening, my name is Paul Jesser. I am the West Coast Regional Director of the American Committee for Shaare Zedek. We're thrilled that you can all be here tonight for what will be a unique and very timely presentation. To introduce our speaker, we ask our host and good friend and outstanding leader of the Jewish community, Dr. Shlomo Melnick. Shlomo?
Hi, thank you. Thank you, Paul. Welcome, everybody. When Paul first called us a couple of weeks ago to have you guys over tonight, he said with pleasure. In his real life, Jonathan is a father of 5 children and 12 grandchildren, and he's a gastroenterologist. Also, a very well published individual in his science, and is runs the Israeli Transplant Authority for liver. He started with liver transplant, but I believe they do all transplants under his aegis. And since taking over the leadership of Shaare Zedek Hospital some 22 years ago, he's really elevated the hospital from a very solid and traditional community service hospital to a world-class institute with really terrific clinical and research programs, which could be the pride of any hospital in the world, and really due to his passion and his energy and his enormously rigorous scientific standards. And I think that the hospital is grateful for his leadership worldwide. But I have 3 personal connections to him, which I will just briefly mention tonight, with your permission. One is that my father-in-law, Salon, passed away 2 weeks ago. Lani's dad, and Gil Saba. And he was on the board of Shaare Zedek for many years, a long-time supporter of the hospital. And even though we're still in the shloshim for his passing, we know that he would be very happy that we're here tonight. Extremely happy, because this was one of his many life passions for many, many years. The second connection that I have with Jonathan is that Cedar Sinai, where I work, and which is my life's passion today, is very, very much involved in the history of development of the new programs and the coming programs in Shaare Zedek. Jack Matloff, who was the director of our cardiac surgery program for many years, spearheaded the new Heart Institute at Shaare Zedek, and now the new underground emergency department has also been spearheaded by the leadership of mainly cardiologists and cardiac surgeons at Cedar Sinai, and hopefully will be able to broaden their base to provide more support for the future development. So that's the second personal connection. And at Cedar Sinai, we're delighted that we could partner with Shaare Zedek and help them in their endeavor. And the final one is very personal, in that Jonathan was my commander in the army in Israel. However, don't get too carried away. I really saw him. He was a big guy. He was head of a very, very large medical unit in the army. I really saw him, and I just recall one personal thing which you don't recall. I'm sure you don't remember. I never saw him shoot a gun, so I can't tell you how he does or how he doesn't shoot. I never even saw him do an infusion on a wounded soldier, so I can't tell you if he can or cannot do a good infusion. But I do know one thing, and this can only happen in the Israeli army, nowhere else in the world. One, I think it must have been a tzom, a fast day, because we had a minyan and we had to read the Torah. It was in the base. And he said, no problem. This guy has the ability, you can open the Torah anywhere, stands up blindly and just reads with perfect truth. And for a commander in an army and a doctor to have that kind of ability, I think is so unique and wonderful that epitomizes our speaker tonight. Thank you.
I never had such an introduction. I don't remember.
That's all true.
I don't remember the last episode of.
That's true, right?
Well,
can we test you?
I lay today in Ashkama Minyan in Young Israel, also unexpected, but thank you very, very much. And that's the opportunity really to start by thanking you, Ilana and Shlomo, for hosting us tonight, especially after the unfortunate circumstances. I was privileged to know your father quite well as a board member of Shaare Zedek, and I'm glad that he was zoche to Seiva Tova, and he was really a leader of the community. I learned during the Shiva that in South Africa, and I know about his activity in Israel, one of the really great Zionist leaders, and I hope he will know no more sorrow, and I definitely appreciate the fact that 2 weeks after his passing away, under the heter of the rabbi, you are conducting this evening here. I will start with a question. How many of you are physicians? Raise your hands. Okay, so about 35–40%, because this kind of presentation should be put a little bit differently to members of the medical profession. So you are around 35% here, so I will talk as if it is intended for non-physicians, but I guess that in the Q&A session, the physicians will have specific things to say. And why? I will speak for about half an hour, and then we'll have 15 to 20 minutes of questions and answers. And like everything in Israel, you remember it from the Israeli army, everything is divided into 3 parts. So my first part will be telling you a little bit about Shaare Zedek, maybe the unique aspects of Shaare Zedek Medical Center in Jerusalem. And then I will talk about some characteristics of modern medicine that differ a little bit between the US and Israel. And then I will tell you how we go about these issues. And my presentation was entitled actually, ultra-modern or modern medicine and compassion, technology and coexistence. A little bit complex subject, but you, I believe, will be able to follow me. So first of all, about Shaare Zedek. We are today around a 700-bed hospital. I know that in the official invitations, I think, for this evening it said 540 or 550. That's one characteristic of Israel. We have around 150 unlicensed beds that will be licensed shortly. So please, so the actual number is over 700 beds. The hospital was founded, interestingly enough, by a group of German and Dutch Jews that convened in Frankfurt back in 1873 and decided that Jerusalem of that time, of the last quarter of the 19th century, needed a modern hospital outside the walls of the old city. Up until then, there were infirmaries, Bikur Cholim and Misgav Ladach, within the walls of the old city in the Jewish quarter in Jerusalem. And Shaare Zedek, in its facility on Jaffa Road that today houses the Israel Broadcast Authority headquarters, was the first modern hospital of that time outside the walls of the old city. Now, this group of German and Dutch Jews were what was considered then modern Orthodox German Jews. They were part of Rav Shimshon Raphael Hirsch group, and they decided that the hospital will be run according to the Jewish law. And they wrote the bylaws of the hospital, and the bylaws are still in effect today. So one would think ultra-modern medicine and halakha and our ancient Jewish law, how can you practice all these breakthroughs in medicine, like in vitro fertilization, like all the new stuff in genetics, for instance, according to the Jewish law? I can tell you that Shaare Zedek, and I'm sure that in this very variable audience, there are Shomrei Shabbat, not Shomrei Shabbat, religious people, those who don't define themselves as religious. After proper research, and I'm talking about medical, halachic research, you can run every breakthrough in modern medicine according to our ancient Jewish law. And actually I see Shaare Zedek today as a living proof to the fact that ultra-modern medicine can go hand in hand with halakha, with the Jewish law. Practically, a hospital is not a yeshiva, so actually there aren't too many practical implications to this saying, but to the fact, except for the fact, that there are few breakthroughs in medicine. I would say that stem cell research, for instance, would be the most prominent, that one would think that have halachic aspects. to deliver a baby or to do surgery or to treat a patient with inflammatory bowel disease has no religious implications. If you are talking about Shabbat, the Sabbath, the holiest rule in Judaism is that when there is danger to life, pikuach nefesh, or even remote danger to life, you are committed to desecrate the Shabbat. So it actually poses no problem. I will say only one word in order to finish with the religious aspect. Take stem cell research. We have one of the largest stem cell research laboratories in the country. Now, as you know, your former president, I guess the views of your present president are different, but your former president banned on religious background, religious Christian background, any federal support, correct me if I'm wrong, Shlomo, for stem cell research, because the main source of stem cells, and for the non-physicians among you, I will just give a very primitive or simplistic definition of stem cells. These are primitive cells, primitive in the way that they did not develop into specific cells that compose the organs of our body. And stem cell research, according to many researchers, carries a promise to solve many of the chronic diseases that characterize modern life, especially those of older age, like Parkinson's disease, like Alzheimer, and so on and so forth. We have a distinguished world-renowned endocrinologist, so I guess diabetes is also expected to benefit from stem cell research. Now, we all have stem cells in our body, but in very low quantities, in our bone marrow. The issue in modern stem cell research is really how to develop a critical mass of stem cells and to decode the secret, how can we affect these primitive, undeveloped stem cells to develop into specific organs, into liver cells, into kidney cells, and not only the cells, but to build the whole organ. Once we have an answer to that, actually the whole issue of transplants from donors will be unnecessary, because we could be born, each one of us, with spare parts that will serve us when we need them. The main source for stem cells are fertilized embryos produced in vitro fertilization laboratories around the world, but that are not used by their owners. What do I mean? If a couple suffers from infertility and he needs in vitro fertilization in order to become pregnant, usually the fertility specialist will retrieve many ova, many eggs from the female part of the couple, and there will be between 10 and 20 ova or eggs, and only some of them will be used. So in vitro fertilization departments around the world, there are hundreds of thousands of frozen embryos that are not requested by their owners, who are the prospective parents, the couples. And they serve as a source for stem cell research. Now, according to Christianity, life starts at conception. According to Judaism, the embryo is considered viable, according to the Talmud, only at the age of 40 days. So, as paradoxical as it sounds, and why does it sound paradoxical? Because sanctity of life in Judaism is a very, very central issue. And it's manifested by many, many rules in the Jewish law, including the approach to the dying patient, where you are never allowed to withdraw life support system, although under certain circumstances you can avoid or refrain from connecting patients to life support systems. But as far as fertilized embryos are concerned, you are allowed, according to Judaism, to every ruler, every Jewish leader or a rabbi will tell you that you can do research on stem cells derived from fertilized embryos once the parents or the prospective parents said, we finished planning our family and you can take these fertilized embryos for research purposes. In Shaare Zedek we have one of the largest laboratories, I believe, in the world, doing research on fertilized embryos. So here you have just one example where research on our religious sources, on our halakha, can enable you to be in the forefront of medicine.